This is humerus, which is the longest and strongest bone of the upper limb. First of all, আমরা এর anatomical parts গুলো জেনে নেব. It is the typical long bone. It has upper end, lower end, and intervening shaft. Upper end a rounded head, lesser tubercle, greater tubercle. In between two tubercle there is a sulcus, which is called bicipital groove or intertubercular sulcus. The line which separated the head from the rest of the bone is called anatomical neck. Greater tubercle, there is three impression: upper impression, middle impression, and lower impression. Lower end a rounded capitulum, pulley shaped trochlea, radial groove, radial fossa, coronate fossa, olecranon fossa. Medially থাকবে medial epicondyle, lateral epicondyle. Above the epicondyle, medial supracondylar ridge. Above the lateral epicondyle, lateral supracondylar ridge. Shaft থাকবে three borders and three surface. Anterior border, upper one third of the anterior border forms the lateral lip of the bicipital groove. Middle one third form the anterior margin of the deltoid tuberosity, and lower part is smooth and rounded. Medial border, upper one third forms the medial lip of the bicipital groove. Medial one third is ill-defined, and lower part from the medial supracondylar ridge. Lateral border, only prominent in the lower part, which forms the lateral supracondylar ridge. Now surfaces, there is three surfaces: anteromedial surface, anterolateral surface, and posterior surface. Anteromedial surface, in between anterior border and medial border. Lateral surface, in between anterior border and lateral border. Posterior surface, in between lateral border and anterior border, lateral border and medial border. In anteromedial surface, in the middle one third, there is V-shaped tuberosity, which is called deltoid tuberosity. In posterior surface, there is a spiral groove. Now the attachment: lesser tubercle give insertion of subscapularis muscle. Uppermost impression of the greater tubercle gives insertion of supraspinatus muscle. medial impression of the subscapularis muscle, medial impression of the greater tubercle gives insertion of infraspinatus muscle, and lower impression gives insertion of teres minor muscle. Now the attachment of the bicipital group, lateral lip gives insertion of pectoralis major muscle, medial lip gives insertion of teres major muscle, and the floor gives insertion of the latissimus dorsi muscle. The content of the bicipital group: tendon of long head of the biceps brachii and synovial sheath, and ascending branch of the anterior circumflex humeral artery. Deltoid tuberosity give insertion of deltoid muscle, and middle part of the anterior-medial surface gives insertion of coracobrachialis muscle. The lower part of the anterior-lateral and anterior-medial surface give origin of brachialis muscle. Medial lateral supracondylar ridge upper one-third gives origin of the brachioradialis muscle, and lower one-third gives origin of the extensor carpi radialis longus, and lateral epicondyle gives origin of common extensor muscle. Medial epicondyle, lower one-third of the medial supracondylar ridge give origin of pronator teres muscle, and medial epicondyle give origin of common flexor muscle. Posteriorly, lower part of the posterior surface give origin of the long head of the biceps muscle. Anatomical neck: attached the capsular ligament, and capsular ligament of the glenoid cavity, because it forms the joint with the scapula, which is called shoulder joint, which is ball and socket type of synovial joint. Capsular ligament of the lower end, the capitulum, thick radial fossa এবং coronate fossa উপর দিয়ে শুরু হয়ে posteriorly olecranon fossa উপর দিয়ে শেষ হবে। আচ্ছা, আমরা যদি এখন কি nerves related to the humerus: axillary nerve in the anatomical neck, and radial group posterior surface of the humerus in radial groups that is related to the radial nerve, and posterior part of the medial epicondyle which is related to the ulnar nerve. Clinical anatomy: common site of the fracture of the humerus, surgical neck, shaft, and supracondylar region. Now the ossification: it is ossified from one primary center and 7 secondary center. One primary center for the shaft, which appears during the 8th week of the intrauterine life. And 7 secondary ossification center appears for upper end and lower end. One for head, which appears first year, and one for greater tubercle, which appear third year of the intrauterine life, and one for lesser tubercle, which appears 5th year of the intrauterine life, and 3 of them joins with the shaft 20 year, and 4 secondary ossification center for lower end, one for capitulum and lateral flange of the trochlea, capitulum and lateral flange of trochlea, which appears second year, one for medial part of the trochlea, which appears 10th year of the intrauterine life, one for lateral epicondyle, which appear 12th year of the intrauterine life, and 3 of them fuses with the shaft 16th to 17th year, and one for medial epicondyle, which appears 6th year of the intrauterine life and fuses with the shaft at 8th year. So this is all about the humerus.